So I'm going to turn my suction off. I'm going to have an order to remove the nasogastric tube, and I'm going to go ahead and start those steps. So the suction is off. Even though there is an order to discontinue the nasogastric tube, be sure and evaluate for bowel sounds, making sure that your patient has good bowel sounds, that they're not bloated. Can they tolerate ice chips? In many circumstances, we will clamp the tube off temporarily. So my suction is off. We would temporarily clamp it off like this, and just allow the patient to eat ice, or to eat ice, and then maybe they have some clear liquids. And if they tolerate those okay, then we would continue on with the removal. So I'm going to have a towel again handy because it's messy. I'm going to inspect my tube, I'm going to inspect my nose, and then I'll be ready to remove it. Okay, after hand hygiene, we're putting on our gloves. I've looked again, the skin is fine. There's no breakdown, no evidence of that. Then also inspect your tube. Is there liquid in your tube? If there's liquid in your tube, you would want to clear it of all liquid. And the reason for that being is that when it's removed, whatever's in the tube could fall into the patient's throat as it comes up. No need to gag them. Don't want to take a risk of dropping anything into their trachea. So I've got mine closed like this, and I could remove it like that. If I do have liquid though, I would inject air into this. And so I'm going to use just my syringe and about 50 mils of air into the tubing just to clear it. All right. If I met resistance, or if this tube was being removed because it was already clogged, obviously I would not do that step. Okay. So I'm going to go ahead and leave that sitting down along the side of the bed. I want to remove the tape. I'm going to tell my patient, take a deep breath and hold it. Hold it, hold it. All right, breathe. Inspect your tube, make sure that it's all there, and then have that properly disposed of in a biohazard container. I'm going to need to provide oral hygiene for my patient. Anybody who's NPO, especially anybody with a nasogastric tube, should be getting oral care on a regular schedule. Oral care, we've discovered, reduces the risk of people getting pneumonia. Especially when they're NPO, the oral membranes get very dried out. They can even crack, and allows microscopic organisms to get in there and cause infection. So oral care for the patient around the gums, the teeth, the tongue. If they cannot swallow, if they're impaired swallow, a device like this can be hooked up to your suction, and you can do oral care for them that way. At the same time you're cleaning in the mouth, you could be suctioning out anything. Like if you had this wet with chlorhexidine or just with some saline, you could actually suction out anything in the mouth as well. So oral care. Be sure and give your patient a tissue to blow their nose, because that is a nasty, nasty feeling to have that tube in your nose all that time and not able to clear your nose.